Greetings and welcome to Jeremiah School Vlogication. This video does not provide medical advice, nor is it intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician and/or qualified healthcare provider.
I want to talk a little bit today about the MTHFR genetic mutation and a little bit about what it is and how it works in the body and what you can do about it. Why should you care about it? Well, it is a big genetic mutation. You may have heard of it, you may not. It's fairly commonly known in the medical field because between 40 to 50% of the American population have this genetic mutation in some form. It's two main types, the 1298C and the 677T. And you could be heterozygous, meaning you got it from one parent, or homozygous, meaning you got it from both parents, or it could be one or both of these. The MTHFR causes serious illness. It causes psychological problems. Also, in the treatment of these causes problems because medications do not work the way that they are supposed to. There are things that should be avoided, things that you should keep out of your diet, things that should be included in the diet, lifestyle changes that help with this genetic mutation. It causes as many as 64 serious health problems. There's a site that you can go to get more information about this. That is www.mthfr.net. And that is managed by Dr. Ben Lynch. And he is one of the well-known experts on the MTHFR genetic mutation. Some of the diagnoses that you'll see with this are IBS, cancer, heart disease, multiple miscarriages. Autism is also associated with this and has something to do with why the numbers of autism are on the rise. However, that being said, because you have the gene doesn't mean necessarily that it manifests in the medical problems or in autism. Something has to flip the switch on of the genetics. Once the switch is flipped on, you start seeing things like kids that are younger and younger showing up with cancer, young people with heart disease. We see all the rise in autism. We see more depression, bipolar, anxiety, all the ADHD that's going on with their kids. All of this is related to the MTHFR genetic mutation. Now, the severity in different people depends on how many you have and whether they're heterozygous or homozygous. So you could have one of those, you could have both of those, you could have it from one parent, you could have it from two parents. There are medications also I want to mention. There have been cases where some children have died after going to the dentist and having nitrous oxide. Not the first time, but one in particular I'm thinking of had to have some work done, had some nitrous oxide, went back a couple days later, had some more work done with nitrous oxide and died because of the genetic mutation MTHFR. So if you have one heterozygous, that means one of the MTHFR genes is coming from one parent, your methylation cycle, which I'll explain more in a minute, can be reduced by as much as 40%. If it's homozygous, as much as 70%. And the numbers go up from there if you have more. Methylation is your cycle in your body that uses B vitamins, specifically the B vitamin folate. Now, folate is converted in the body during the methylation cycle to L-methylfolate. Then that allows homocysteine to convert to methionine. And I'm not going to go into all the chemical explanations of all of these. Just suffice it to say, I'm basically going to tell you how this system works. The methionine combines with SAMe, and this is what the body uses to make proteins and neurotransmitters. Now, your neurotransmitters are serotonin, dopamine, and norepinephrine. Those are the chemicals that are released in your brain in certain amounts that make you feel okay, secure, afraid, angry, joyful, anxious, in fear for your life. All of those are controlled by the release of those neurotransmitters and how much of them is released. It also depends on the balance between all of them. So if they're too high, too low, or out of balance, you're going to see mental health issues arise. Over time, then, you're going to have depression, anxiety, and that's why all of these neurotransmitters, medications, are being diagnosed. We have so many people that take antidepressants, anti-anxiety drugs, all of the children that are on medication for ADHD, that, 20, 30 years ago, you didn't see this stuff. At the same time this happens, that those things are out of balance, because the methylation cycle isn't working properly, the homocysteine, instead of being used, builds up in the body, and that's what causes medical problems. So your physical stuff like heart disease, cancer, stroke. The things that should be avoided if you have the MTHFR genetic mutation, and if you're not sure, just avoid them anyway. Folic acid, synthetic B vitamins. These are the chemical form of vitamins that are added to almost all of our foods. So anything you see that says it's enriched or fortified, that has synthetic B vitamins, sometimes synthetic E vitamins. These cannot be broken down and used by someone with the MTHFR mutation. Herbicides, pesticides, any kind of GMO foods, any chemicals in cleaners or fragrances, any of that cannot be broken down by the methylation cycle and gotten out as toxic waste. So it floats around in there for way too long, causing a lot of problems, and then throwing the neurotransmitters in the brain into imbalance, which causes anxiety, anger, aggression, depression. So all of that builds up and causes those problems. There is no treatment or cure for the MTHFR, but it can be managed with diet and amino acids. The amino acids have to be in the correct form. For us, with our kiddo, we had to have a doctor that was a specialist in this area because he had so many other genetic mutations with the MTHFR that the things he needed for the MTHFR genetic mutation were exactly counteractive with the CBS and the COMT mutations. I won't cover all of that in this audio recording, but suffice it to say that trying to guess and figure this stuff out on your own is daunting. This video or audio recording is just meant to get you started, kind of give you some tips on this until you could find some medical guidance. And let you know what these vitamins are, where you can find these things in your diet that you need. So B9 is folate. This is not folic acid, not folic acid. Folate is necessary for cells to divide properly. If you don't have enough folate, you're going to have things like birth defects, neural tube defects in newborns. There are going to be other genetic defects that'll take place because the cells can't divide properly. There's a list of things that you can find that have the B9 or the folate in it that's in the natural form, that's not folic acid. Folic acid is synthetic. can't be used by people with MTHFR. B12 or cobalamin is necessary for the brain, the nervous system, red blood cell formation, and it's found in a lot of your proteins, your animal products. Vitamin B6 is pyridoxine, and it's used in the brain and nervous system function, helps digest proteins. So without that, you're not going to break your proteins down appropriately. And it's found in a lot of your vegetable forms. B2 or riboflavin is necessary for energy production. Vitamin C, of course, most people know this one, provides your antioxidants that heal the body and make sure that the immune system is working well so that it can fight off things that you didn't even know you were coming in contact with. Vitamin D3 supports the immune system and stabilizes the mood. Very, very important. However, our kiddo has a little trouble processing the vitamin form of D3. The best way to get vitamin D is exposure to sunshine, 20 minutes a day with 50% of the skin exposed. Although this doesn't necessarily work in the winter and sometimes you have to supplement, that is the best way to do it. Also, it needs to be balanced with magnesium, so that's something to look into because the two, without one, the other doesn't work. Found also in a lot of protein or animal products. That is a better way to get it than with supplements. Vitamin E heals the skin, supports the immune system, and protects the cells from damage before the damage even happens. And it's found in a lot of vegetable forms. Betaine or choline supports the liver. Now, the liver is your main detoxification organ. Without that working properly, you're going to have the toxins, the homocysteines building up in the blood that cause the medical problems, the health problems, but also throw off the neurotransmitters, because for those to be in balance, you have to have the homocysteine level in the right place, and you have to be able to detox extra neurotransmitters. So when you get angry and there's extra dopamine floating around in there, norepinephrine, your body has to be able to clear that for you to be able to calm. So with our kid, the MTHFR, we tend to see if his diet gets off and his neurotransmitters get off, over time, his anger builds up, he becomes aggressive, unmanageable at times, and it will take him a good 3 days to clear those and come back to a calm place because of the MTHFR mutation. N-acetylcysteine or NAC feeds the liver, it supports lung function and helps detox heavy metals. Very important, because if you have the MTHFR genetic mutation and you have trouble detoxing and you've been introduced to any heavy metals like lead-based paint or things in pesticides, herbicides, vaccinations, toxins that are in your foods, you will struggle to detox those. And so they're floating around in there, storing in the brain. Glutathione is actually used in the treatment of Parkinson's and Alzheimer's, lung diseases, and other things that are associated with aging. Turmeric, you're hearing a lot of stuff, hopefully you're hearing a lot of stuff about turmeric that's anti-inflammatory, anti-cancer properties because it contains curcumin. So maybe curcumin is more what you're hearing. This is a spice, turmeric. Curcumin can be bought as a supplement. It contains B6, potassium, manganese, and iron, all of which are really important. That's a superfood right there. EPA and DHA, these are your omega-3 fatty acids. This helps tremendously with ADHD, ADHD-like symptoms, asthma and depression. Really important for MTHFR. It's found a lot in nuts and seeds and cold water fishes. We can't get our kid to eat algae in cold water fish and walnuts, flax seeds. So we supplement with krill oil. Krill oil is a much more usable form than fish oil. It needs smaller amounts of it. It's more stable. And we have seen tremendous differences in our kids' temperament, mood stabilization, his attention span, tremendous change just by adding this. Now, if you're looking at this and thinking this is daunting, I cannot eat all of that food in one day. There are foods that are all, I'm going to call them all in one place foods, because they have everything on the list that you need in those foods. So those are broccoli, beef, collard greens, salmon, sardines, and spinach. Some foods that are really good for providing the nutrients needed by the MTHFR genetic mutation, or anyone for that matter, really: almonds, avocados, Brussels sprouts, kale, and turmeric. It is really important that the foods be organic, because people with the MTHFR genetic mutation in any form struggle or cannot detox chemical herbicides and pesticides. And if the food's not organic, that's what you're getting. GMO foods are also a problem because they contain glyphosate, which is found in a well-known weed killer. Glyphosate in the body mimics hormones and causes tremendous confusion in how the body reads signals that are being sent out by the brain. Fish should be wild caught. There's a problem with the chemical saturation of farmed fish. Same thing with your chicken and your eggs. They need to be free range. It's a huge problem when they're contained in huge barns, all packed in there. There's use of chemical medications and things like that that are passed on into the meat and the eggs and can't be detoxed. Or it takes a really long time to detox them out. Meat should be free range and grass-fed, all for the same reasons. Grass-fed meat, of course, has more nutrients in it. Grass has more nutrients than dry hay, obviously. Processed and packaged foods are loaded with chemical preservatives, artificial ingredients, food dyes, all of that, very difficult to eliminate. So with our kid, we see him, if he gets a little bit of it, sometimes he's okay. Depends what it is. But if he keeps getting more and more and more, it builds up. You can see it. You can see his mood gradually declining. You can see the anger coming in. He reaches the point of meltdowns and aggression and anger, and just, it's one of those days you could probably compare it to when you feel like you're in a bad mood but you don't know why, except times 100. But it's the same thing. And you can't change your mood all day. He can't change his mood all day. These kids, these people can't change their mood back. They might learn how to control some of the behaviors that go with it, but the way they feel is extraordinarily just anxious and depressed over time, angry maybe. So when these toxins build up over time, they also form an environment that's ripe for disease formation. So it's not just a matter of discipline or parenting, and really watching your kids' diet and providing them with proper nutrients is parenting. That is good parenting. So if this is what your kids need to be able to function better, to be able to do well in school, to be able to, just do well later, then that's what good parenting is. The other thing is, you don't want them to reach 20 or 30 and have heart disease, or be having strokes prematurely, and all of these other illnesses that come as a result of the MTHFR genetic mutation. We want to set our kids up to have long, healthy lives and to be as happy as they can possibly be. So that in a nutshell is why you should care about the MTHFR genetic mutation. And keep tuned in, because we're going to cover some of the other genetic mutations and also talk about how this specifically relates to autism and give some information about that. Signing out, this is Wendy Parsley with the Jeremiah School Vlogucation. Like and subscribe to keep getting more videos like these. I hope this helped. Have a great day.